Welcome back to Veterinary Vertex, the AVMA Journal's podcast, where we delve into a behind-the-scenes look with manuscript authors. I'm Editor-in-Chief Lisa Fortier. Today, we're discussing how a randomized clinical trial finds no clinical benefit for needle replacement before sub-Q vaccination in dogs, with authors Jane Sagaser and Rachael Kreisler. Hey, Jane and repeat visitor Rachael, thanks again for being with us today.
Thanks so much for having us.
Thanks for having us.
Yeah, I really like this topic. It's not just about safety for veterinarians, but think of the environment. And the other thing I was taught early on in my internship, it's not just the cost of the needle. Somebody has to order it, somebody has to stock it, somebody has to empty the recycle or the needle bin. And so I just really, really love this topic and so grateful you guys brought it to us at JAVMA. And Jane, before we dive in, share a little bit about the background and what brought you to investigating this idea of needle replacement.
Yeah, absolutely. So when I was an undergrad, I was working at an animal hospital as a veterinary assistant, and I noticed that there are certain practices like replacing needles that seem to be done differently by everybody. Some veterinarians want to do it, some veterinarians don't, and same with technicians. Seems like everybody has a bit of a different opinion on that. So I became interested in clinical research, not just about that, but just in general. And so when our vet school offered a summer research program for students to pursue doing a research project, I was definitely interested and knew I wanted to participate, especially in something that was clinically relevant. So I was definitely intrigued by Dr. Kreisler's proposal to do this project specifically because I would have assumed that there was already research behind this because of how many people, how commonplace it is to replace needles before vaccination. And so, yeah, I want to work on that project. And also because I've been always passionate about sustainability and the environment and reducing waste as much as possible. So being able to work on a project where we're also, investigating ways to reduce medical waste, that was very exciting for me.
Yeah, it's actually so cool. So this JAVMA article, as we said, discusses how pulling up the vaccine. So you might actually need to put saline in the lyophilized vaccine, pull it up, and then inject the dog is clinically acceptable. Uh, Tell us a little bit more about how you and Rachel came up with this idea.
Yeah, so just anecdotally, it seems like so many people, like I said, have different opinions in the veterinary profession. And not just opinions on this, but different justifications for why they change needles or don't change needles for vaccination. And so the recent in vitro study that was published on needle sharpness showed that in a survey of veterinary professionals, 76% said that they do routinely change needles or replace needles for vaccination in dogs. And so of that 76%, the majority were citing concerns of dulling of the needle, then affecting patient comfort. And so that study did ultimately find that needle sharpness is very minimally affected by puncture through a vial septum. And so what we wanted to do with our study ultimately was find out how the one puncture through a vaccine vial is going to affect the dog's reaction itself, so in vivo. And so something else that we saw online was that the CDC actually, in their vaccine administration guidelines, they recommend against changing needles in for human vaccinations, and that up to now, there's been no research in veterinary medicine to back up, any evidence to back up why this practice is so commonplace. So we wanted to be able to, actually do this study to determine whether dogs are be able to, have a different reaction based on a replaced versus non-replaced needle. And anecdotally, we've also heard just from colleagues super commonly, you've probably heard this too, or maybe you think it yourself, that when you change the needle, some people claim that it does, or when you replace the needle, that it feels like it goes in more easily when you go to vaccinate an animal, or that they can just tell the difference. So that's a claim that we want to be able to test as well to see if people can actually truly discern a difference between a replaced and a non-replaced needle.
Really good points. How did you and Rachel design the study to assess and evaluate those questions that you just brought up?
Yeah, so we discussed quite a bit together, in a group with the other researchers as well to see, you know, what would be the best ways to evaluate dog reactivity, not only in the sense of like how the heart rate going up. So we want to test sympathetic nervous system, what's going on there, but also their actual reactivity when being punctured by the needle itself. So we spent a lot of time discussing that and looking at existing literature, and then most importantly our pilot studies are really how we landed on analyzing the heart rate as well as the holistic reaction score.
How did you test the injector's reaction to, like, is that dull or not?
Yeah, so for each dog in the study, we had them receiving two vaccines. And so with one of the vaccines, the needle was the replaced and one was the non replaced. And so the injector was blinded as to which was which. And so we had them compare after doing both vaccines on the same dog. We asked them, which needle did you think was the one that was replaced?
So what were the most important findings, that supported your conclusions?
Well, I thought that it was very helpful to have looked at several different perspectives. So I think that, seeing no difference. So it was really the three together, seeing no difference in an objective measure of heart rate, no difference in this blindly rated holistic subjective rating of the dog's reaction to the puncture, and not having the injectors, most of whom did not want to make a guess, but or many of whom, I guess, did not want to make a guess, and then those who looking at those, also who did, being unable to tell a difference. I think for us, that provided pretty good, evidence that we really weren't seeing anything that was clinically meaningful. And this didn't really surprise us after the in vitro study, because, the biggest, defect that we saw in the worst affected, needle with the gross defects was about a third of what, humans are able to tell the difference of. So, of course, we can ask a human, "How much did this hurt?" Or, "Can you tell the difference between this needle and that needle?" And so, these findings were very congruent with what we'd seen, outside of the dogs as well.
It's an elegant study. It's quite simple and it's elegant and it's a myth buster. So what could be better?
Thank you.
Are there any times in clinical practice that replacing a needle would be appropriate?
Certainly, I would say if there's any type of, damage, you drop the needle, it impacts the side of the vial, sort of strongly. If you have any concerns about contamination, but yeah, those are so we're never saying never do it, just don't do it as part of routine practice. So that's but we, in the discussion, we did look into sort of concerns about just sort of environmental contamination passing through a vaccine vial septum. And there wasn't a lot of literature on this as well. But if you think about everything you're passing through on your way into the dog, and we're not taught to prep, the skin surface, and in fact, laboratory animal manuals recommend against prepping the skin surface. And we don't see, we had over 10,000 vaccine events in our records and had no records of abscess, and it's certainly not something I've encountered in other environments either, for small animals. So we felt pretty confident that routine use was not a significant risk for injection site contamination.
Yeah, all makes sense. And at least in horses, they hate that cold alcohol applied to them. So now you've stressed the animal out and then you're going to stick a needle in them. And it's just not necessary. Rachel, we heard a little bit about Jane's journey into this topic. What about you? What sparked your interest in needle replacement?
So what sparked my interest for that first study was, I signed up to give vaccines to humans during the COVID pandemic when they were sort of recruiting everyone who could stick a needle in anything, and that's where I first encountered this message from the CDC that changing the needle after drawing out the vaccine was not indicated, and I was like, "Huh, oh, why do we do this for animals then?" And I really went down a rabbit hole, and I think a lot of this ends up originating way back in the 90s, which to me does not seem that long ago, but apparently is quite a long time ago. Uh, and the American Diabetes Association had sort of been like, if you're gonna reuse your own needle, to give yourself insulin syringes, as long as you kind of follow some general guidelines, that's probably okay. And Big Needle was sort of like, having none of that. So they came up with these scared straight images that show what happened to a needle after reuse. They put them in the boxes of syringes they were selling to people, and these just really got embedded in the public imagination. And I'm going to assume pretty much all of us have seen these at one point or another, these dramatically deformed needle tips. Although, of course, everything looks scary under a scanning electron microscope, but these were never published with any well, one, they were never published. They were never in the peer-reviewed literature. There was no information about the needle size. There was no information about what magnification it was, what technique had been used in terms of this reuse, and so it was actually even further down the rabbit hole, going into the Internet Archive Wayback Machine, where you can find things that no longer websites that no longer exist on the internet. And there was even some citizen science done back in the day. There was a professor who had diabetes and also had access to a colleague with a scanning electron microscope. And the professor was sort of like, "Huh, well that's weird because I reuse my needles, and I don't feel like I can really tell the difference." And so they tried to reproduce these images again contemporaneously, and weren't able to without a sort of extreme, sort of stabbing, dropping it on a table or something like that. And so, unfortunately, the Internet Archive only has the text and not the images, but it led us to do our first study, looking at again what happens to sort of just passage through the septum, which of course are not the same as human tissue, and really seeing that it's not as dramatic as we may have been led to believe, at least for the use for our purposes of drawing up the vaccine.
So scared straight doesn't work. And is it scared straight a comedy?
I It probably is. I mostly, again, speaking of the '90s and the scary images about what happens on drugs and things like that. So I guess maybe, but I know that I've seen them in presentations where it's like, here's what happens to the needle when you reuse it, and don't ever reuse the needle. But uh,
Yeah, I love this, and I encourage people to challenge dogma or evidence-based sort of things too. So, how do your findings and how do you encourage clinicians and students to think more critically about tradition?
So I do teach critical appraisal of the veterinary literature at Midwestern University, and I guess what I would say is pay attention to that voice that goes, "Huh," and just sort of as you're going about your day, you've pointed out that this was a pretty simple study. A lot of the studies I do are very simple, and there are things that you can do in your own clinic. You can, do them. I sometimes present my findings at conferences, and I say, "Wow, go ahead. If you don't think this is your experience, test it. And you know what? If it's different, let me know, because nothing gets an epidemiologist more excited than a different pattern of disease, or whatever it is that we're looking at, because now we can know a little bit of something about maybe why it happens. So." So I actually would love people to go and try to prove me wrong, use robust methods, but, maybe we can find a difference. So maybe it matters, for a subpopulation I didn't enroll enough of, or maybe it matters, in some environments rather than others. That would be so exciting, because then we would have some insight into what's really going on.
Yeah, I think you just answered or at least teed up my next question of every study we do leads to more questions. So, what do you think are the most important things to address next in this area of needles or vaccines?
One thing that was really interesting in our study was we saw that because we did standardize that when rabies was given, it was always the right rear limb, and the DHPP vaccine was always the front right limb. And so since that was standardized, we did see a pattern of when the rabies vaccine was given, I believe, second, and obviously, like, was it first that it was?
The order
Oh, the
was
order. Well,
randomized. Because
when
we right, because we oh, sorry. No, 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 you're right. Sorry, you're
yes,
saying the findings,
yes.
not the methods. Sorry. The order given was randomized, but the findings are exactly what you're going to say.
Exactly.
Yeah.
So when we, we're looking at the data, and we saw that when rabies vaccine was given second, because again, it was randomized, as Dr. Kreisler was saying, it wasn't always given second, but when it was, we found that that specifically, we did see more of an increased heart rate in the dogs versus any other time or any other order of vaccine. Um, and again, not depending on whether it was a replaced needle or non-replaced needle, but just specifically the rabies vaccine second, we saw a statistically significant change in heart rate. So it's interesting. That kind of leads us to wonder, does it have to do with where we're placing the vaccine? Do they not like that right rear area? Or could it have to do with the rabies vaccine itself?
Yeah, that is interesting. Um, yeah, it's not wind up, obviously, because it was randomized whether it was first or second. Were all the vaccines cold? I always wonder about that when I vaccinate my dogs and horses.
Yes.
Yeah, they should all have been about the same temperature. They were kept in a refrigerator up until just before the honest broker drew them up and handed handed them off in the order they were to be given. And
I wonder if that would be an area to investigate. I have two friends that are on GLP-1, and they both swear that it's less painful if it's at room temperature. I
oh,
think it's the
interesting.
needle, and they're not very good at injecting themselves, but
I'm also intrigued to find out if some of the things that I do actually work. So I try to desensitize the area by, sort of touching and then, oop, there it went. But I have no more evidence for that working than I do for changing the needle. It's a technique that is used in human medicine, but the evidence is not completely clear cut about whether that works as well. Although I will say when I get injections and I've gotten different vaccines and whatnot at different times, I feel like that helps me. But uh, yeah, we'd have more things to check.
when you do a study, there's always like, "Oh, I wish I had this," or "I wish this was better." What methodological improvements or other technologies could have helped you in this study?
We definitely tried different ways because we originally weren't sure if we were going to be measuring blood pressure or heart rate as our objective measurement. And so in our pilot studies, we tried, doing blood pressure monitoring. We tried monitoring heart rate, obviously manually, but then also we tried actually with an Apple Watch. So we tried with, putting an Apple Watch around the dog's arm to see if that would be good for monitoring heart rate.
It's in the
Yeah, there
literature.
is literature with that, but we found that it was difficult considering how many different sizes of dogs we would be having in our study, and so we ended up going with, a polar heart rate monitor that's meant for humans, of course, and there are studies showing its efficacy for continuous heart rate monitoring in dogs, but yeah, I think even with that, and it was mostly effective, a lot of our data, unfortunately, couldn't be used with that heart rate monitor. Not a lot of it, but a good chunk of it we had to not use for our heart rate data just because it wasn't completely continuous or it wasn't reading for whatever reason. And we tried to mitigate that with an ultrasound gel and just trying to get that good fit on the dogs. But given that it's not made for dogs, it wasn't perfect. So I think that would be a great next step or next type of technology would be continuous heart rate monitoring for dogs and cats.
Yeah.
Though just to be clear, with a negative finding, we were fully powered. We knew that the heart rate, the polar monitors were imperfect for this use, and so we did reach full enrollment for the usable heart rate readings.
Somebody mentioned earlier that the CDC has recommendations on needle replacement. Do you see this work as influencing policy for veterinarians?
Unfortunately, CDC didn't provide any citation or rationale for why they don't recommend changing. So unfortunately, we can't act ASIP now, what they were thinking, since there's been quite a lot of change over there. But we speculated because, of course, they're quite interested in human health and safety. That it was my guess would have been that it's due to the risk for needle stick injury when folks change the needle.
How about for veterinary medicine? Do you see this influencing guidelines, protocols, or policy?
Great question. So it's already in our draft of the soon-to-be released Association of Shelter Veterinarians shelter vaccine guidelines that should be coming out later this year. So both the in vitro and in vivo study are referenced in there to support not changing the needle.
Before we wrap up, let's have a little fun. Rachel, what's one belief or habit in veterinary medicine you'd love to see gently retired?
I still encounter veterinary professionals who routinely apply Caro syrup to the gums of young animals after surgery. And It's a technique that doesn't work, but it's also for a condition that's not appearing to happen routinely. So I would love to stop that. Or again, if you think it's something that you do see a difference, great, let's study it, let's figure out what's different. But at least, in one of a couple of my earliest papers, we looked at actually kittens are far more likely, and these when I talk about kittens, I mean kittens aged 8 to 16 weeks, far more likely to become hyperglycemic. Over half become hyperglycemic, in fact, after surgery, and none that we measured in 75 kittens became hypoglycemic. Um, and then we, of course, looked at the next step, which is half the kittens got Caro syrup and the other half didn't. And we did not see any difference in blood glucose levels between the treatment and control group. And we actually were not surprised because we had done the math beforehand and had done a pilot study where we looked at what is the absolute maximum amount of Caro syrup you can actually get on these. We use different brands of cotton swabs and like really loaded them up and then sticking him in the buccal pouch of the kitten, and how much can we really load up on these guys? And we did the math, and even if 100% of that was bioavailable, which of course it's not, but even if it was, it wouldn't be enough to raise the blood glucose by a meaningful amount. So, we still were glad to have done this, to have done the study, but it kind of confirmed what the math had suggested to us. So, unfortunately, again, I think it's one of the areas where clinical practice intersects with the feelings you get that you're demonstrating to yourself and to your colleagues that you really care, which is so important. Where veterinarians and veterinary professionals are caring people, and I think it's just really hard to convince people's feelings about something that makes them feel good and makes them, feel like they are doing a good thing for an animal, that they are demonstrating that they're good doctors or good techs. I've been fighting this fight for uh, quite a while now, and I'm not sure I'm winning, but
Yeah, I remember giving a talk at a human conference on microfracture and articular cartilage repair, and I asked for a show of hands before I gave this talk that, when you put those slides together, you spend days making sure you're up to date on clinical research. And I asked for a show of hands, and then I gave my talk, and it basically, though the title of the talk was "Put your awl down." The awl is the thing you use to make microfracture holes, all of them. And so the talk basically was how detrimental microfracture is. And at the end of the talk, I asked for a show of hands and how many people were still going to do microfracture, and almost all of them still raised their hand. Because they still thought it worked. Despite all that evidence, they still believed in their hands that it worked.
yes, the "in my hands" is a very uh, challenging uh, sort of term to overcome. But every time I presented these findings, I said, "Look, if you think this is working or you're seeing something else, that is actually so exciting. Show me, tell me, and we'll figure out what's different." I haven't had anyone reach out yet.
And Jane, over to you. What is a small thing at work or outside of work that reliably makes your day better?
Well, for me, definitely coming home and seeing my cats and my foster kitten. One of my cats, Alfie, is right here. He decided to make an appearance. But yeah, they always just bring me so much joy. And even after a tough day, they remind me why I'm in this profession.
Well, Rachel and Jane, thanks again for being here with us today.
Thank you so much for having me, Liz.
Great. Thank you so much.
For our listeners and viewers, you can read Jane and Rachel's article in JAVMA. I'm Lisa Fortier. Be sure to tune in next week for another episode of the Veterinary Vertex, and don't forget to leave us a rating and review on Apple Podcasts or wherever you listen.